Americans are becoming primed for heroin addiction through the growing use and abuse of prescribed opioid painkillers, according to the Center for Disease Control and Prevention. CDC Director Dr. Thomas Frieden said there is an incorrect perception that reducing opioid painkiller prescriptions leads to a rise in heroin addiction, but the reality is that both drugs are essentially the same chemical and have the same effect on the brain, but the street price of heroin has been about 5 times less than the price of opioids. These results are very scary because they say that those who have been taking painkillers, opioid painkillers, are 40% more likely to abuse or be dependent of heroin. The process is is like this. They get in prescription, they develop resistance to the prescription, they start crushing the pills, they start snorting them, they start shooting them. Then they realize that heroin is so much cheaper on the streets, and so they go out and they incur in high-risk activities like shooting up without the
You've exposed
hygiene, they expose themselves to now we're starting to see places like in Indiana, because of the heroin addiction, we're starting to see outbreaks of HIV that are very serious. So we see that the problem of overprescribing a painkiller is generating several layers of health crisis.
I mean, though, don't you really sympathize with people that are in chronic and debilitating pain because they need a fix? But unfortunately here we have these quick fixes of opioids. They are overprescribed. We see entire pain management clinics popping up and droves of people flocking to them because you need a quick fix when you're in that much pain. I really sympathize with them, but at the same time, we are a society that over-medicates, and until we bring some awareness to this issue and how very highly addictive these substances are, Percocet, Vicodin, other opioids that are prescribed to people at random, maybe we should scale this back, and people really need to be aware of what they're getting into prior to ever taking a drug like that.
It is. The comparison with other drugs is very, very scary. If you put the numbers, those who consume cocaine are only 15 times more likely to be addicted versus the 40% if you take painkillers.
Highly addictive.
Marijuana, only 2%. Alcohol, less than 2% probabilities of you getting involved with heroin as an addict versus 40% with painkillers. The rate where heroin addicts are dying in the country is very alarming. It nearly 4 times what it was in 2006. We have almost 8,300 people dying every year of heroin addiction and heroin overdoses. It's really, really sad. And the whole thing is a perfect storm. In one side, we have very cheap heroin flooding the streets. On the other side, we have a population that it's already been exposed, maybe for many years, to these opioids. So once they get in touch with heroin, they already have a big resistance that we never seen before. Dr. Friedman, though, he says that it's not about just saying, oh, let's take out the opioids out of the system, because it does not work like that. Cancer patient, terminal patient, patients that really have a pain condition that it's for the rest of their life, they do need access to these drugs because it's the only thing that actually helps them. But the reality is that we've been in that debate for 100 years, that balance in between, the actual effectivity of the painkiller and the addiction risk that it
I mean, they do need access, Jose, but at the same time, states are making it much more difficult to obtain these drugs. They've developed systems where you have to give a social security number every time you get a single pill out of a pharmacy. Any doctor prescribing one of these drugs, they're put into a system. In my state, it's called Casper, where they're registered. They're really keeping track of this. That might be another reason why people are turning to heroin, because these drugs are not as readily available as they used to be.
Exactly, and the proposal is that we as a society, we need to do certain things for this to end. We have around 500,000 heroin addicts in the US, and the biggest surge is in groups that we never ever thought before that they will be associated with heroin addiction, mainly white male and women. Those are the two groups that are having 100% increase in use over a year period, which is very, very fast for this. What they are proposing is this 4-step plan to address the situation: tracking the use of prescription painkillers and making sure that it's electronic tracking for this type of painkillers, providing treatment to individuals instead of jail time, obviously, cracking down on smuggling and making it less available on the streets so the price goes higher, and mainly an economic way to deter people from using heroin. by increasing the price, taking it off the streets, and also making sure that that police officers and first responders have access to naloxone, which is a drug that saves the lives of those who are currently on overdose of heroin. It quickly reverses the effect, and they have a chance to survive. So these are the 4 axes of their plan to curve down on heroin addiction and the death that it occurs. But we want to know how you feel about the situation, the rise of heroin use in the States. Let us know your opinions, and please subscribe to the Lib TV 2.